Hello, I'm Shawn Terlson, President and CEO of Shepherd's Care Foundation. I'm reaching out to our Shepherd's Care family as part of our ongoing commitment to transparency. I'm letting you know that late yesterday we received notice that two more residents in the seniors' rental apartments at Kensington Village tested positive for COVID-19. One of them has been in self-isolation since March the 16th and was connected with our very first case. The second, a new resident that moved in on March 20th. She had been previously receiving home care from a different provider. On March 27th, we locked down all of our facilities, including a freeze on new residents, so we know that the potential entry point has been closed off. Although it is not welcome news to report new confirmed cases, both of these cases arose in senior rental apartments, where our level of control is more limited, not in our Shepherd's Care homes. We have no COVID-19 cases in our long-term care facilities. Further, of the two new cases, one was already in isolation from our staff's decisive action, and the second moved in right before we locked down to new arrivals. The measures we have taken to slow this thing down are working. Since the beginning, we have constantly gone beyond and above Alberta Health Services guidelines to protect our staff and our residents. We've all seen the countless examples from around the world on how fast this virus can spread when these measures are not taken fast enough. Unfortunately, I can also confirm we have one healthcare aide that has also tested positive late yesterday. This individual arrived at work with a fever on April 1st and was immediately sent to isolation for testing. The robust screening measures we put in place for staff and essential visitors are working, folks. Our clinical team worked late into the evening on Friday and identified a total of 33 residents in rental apartments and 8 staff members that had potential exposure to these new cases I've just identified. All of them have been notified, put into isolation for 14 days, and will be swabbed. We also reached out and talked to each family of these 33 residents to let them know about the potential exposure and swift action we have taken to protect their loved ones and our residents. Although this is not the news we want to deliver, to the family members we just called, truly know, I understand your fear, your anxiety, and the worry that this news has brought. Please know we acted immediately once we had the information, and please know we were doing everything we can to protect your loved ones, our beloved seniors. We are praying for you and your loved ones every day. Our frontline staff are the real heroes of this crisis. Healthcare is not just a profession, it's a calling. To all of our nurses, clinicians, and healthcare aides, a humble thank you. You help ensure our residents are safe, cared for, and loved 24 hours a day. To our support staff that are cleaning and disinfecting, you are a critical link in the chain keeping our seniors safe. Thank you. To our dedicated recreation and pastoral staff, you ensure that our residents are living their life to the fullest during these dark days of isolation and uncertainty. Spiritual care is needed now more than ever, and I thank you. As I reflect on the remarkable love and dedication of our staff, I am reminded of Galatians 6:9. Let us not become weary in doing good, for at the proper time we'll reap a harvest if we do not give up. You are prayed for and greatly appreciated. Please know that. I am also humbled to report that we've had several community partners step up and help us with donations of masks and personal protective equipment. I want to extend my personal thanks to Grant Miller of Service Master Restore, George Zumas of D&D Dental Clinic, and Dr. Taha Yuma of Summerlee Dental. These are just a few of the local businesses and caring people that had extra gloves and masks and donated them to Shepherd's Care. Masks, gowns, gloves, and other personal protective equipment are in short supply, not only with us, but worldwide. If you or anyone know has access to these items. We would really appreciate any amount you could donate. Every little bit helps. As a charitable organization, we can issue you a tax receipt for your charitable donation. I appreciate your prayers. My team and I continue to meet every day to ensure that we are acting decisively and diligently as we can to stop the spread of COVID-19. Thank you, and God bless everyone.